Good morning, everybody. Welcome to a special live edition of the Healthy Heart Show, your home for the 100-year heart. We are always bringing you excellent guests from around the world, providing you different perspectives, different ways to reach your 100-year heart. We have a great guest for you today. So we have Dr. Joe Mather, MD. He is a board-certified family practice physician who practices functional medicine in New Orleans, Louisiana. In his practice, he focuses on delivering cost-effective and practical medical care with a focus on gastrointestinal health. He spends time working with patients suffering from complex diseases and helping patients to optimize their longevity. And we were just talking before we hopped on this live, and he was serving for many, many years as an internal medicine practice as the medical director. So he spent a lot of time helping patients optimize their lipids, thyroid, cardiovascular health. So all of these, which we can bring to you to really kind of optimize your wellness and get you feeling your best. So welcome to the show, Dr. Joe Mather.
Thank you. I'm excited to be here.
All right. So I think we can just roll right into it. I think we got a lot to cover. We're
Sure.
open to questions. So we've got the chat box open. We are going through StreamYard. So if you follow directions on your StreamYard, then you can get logged in there if you're listening and throw out some questions. All right. So we are just going to roll right into it. I wanted to kind of start with gut health because I really think that it's so foundational, so critical. When taking new patients, we often start with, what's your diet? What's it like? How is your digestion? And maybe they think, why are you asking so many questions about my digestion, about my gut? I'm here for this or that. So why are we honing in on this? So what are some maybe non-GI symptoms that are often actually driven by gut health?
Fantastic question. In my experience, they are skin conditions primarily. So rosacea, in my mind, is simply a gut problem until proven otherwise.
Mm-hmm.
Very frequently, joint pain and rheumatoid arthritis can be directly driven by gut health. And man, maybe most importantly, anxiety, depression, and brain fog. Brain fog is so huge with gut problems. I was talking to early in my career, the head of Aerodiagnostics SIBO breath test, the lab, name's Gary. And Gary said that they had to continually change their breath test instructions because brain fog was just the #1 complaint of patients with SIBO, which we can talk about probably later. But brain fog, it happens all the time. Very, very common. And happily, when you do a good job on the gut, it goes away.
Yeah. Well, and it's probably one of those things that we see so often that, oh, I think I'm just getting older. I forgot my kid's birthday, or maybe, I met them a couple times, but I still can't remember their name. And it's programmed as this normal evolution of aging where it's really not. We have to kind of stop and say, no, we can do better than this. And so kind of getting into the root cause of it. So maybe elaborate a little bit more on SIBO specifically, and what sorts of signs and symptoms and kind of some best practice in terms of diet we can look for.
Absolutely. And I just want to nod on one of my favorite soapboxes is that, memory decline and cognitive decline, brain fog, that's not normal as we age, right? Because how many 90-year-olds have we met that are sharp as a tack?
Yeah.
That should be our expectation. You said 100-year heart, right?
Mm-hmm.
100-year brain too, right?
Exactly. Oh, yeah.
SIBO is a big part of our practice. It stands for small intestinal bacterial overgrowth. And this is a condition in which bacteria that primarily reside in the nose, sinuses, and mouth creep downwards into an unhealthy small intestine. And they take up shop where they're just not supposed to be. When you look at you think about the GI tract, the farther you go down from top to bottom, you're supposed to go from a relatively, let's say, sterile environment all the way down to a colon that's teeming with bacteria, right? So, but the stomach is full of acid, right? There should be no bacteria there to speak of, really. Small intestine, very, very few. But then as you go down towards the large intestine, more and more bacteria. So SIBO is really just a condition where you have bacteria in what's supposed to be a sterile, clean part of the small intestine. It causes a bunch of GI problems, primarily bloating after meals, brain fog, alternating diarrhea, constipation, and leaky gut, right?
Yeah.
The problem where we get foggy and confused, particularly after meals. That's what we see a whole lot of in our clinic. And It's important to note that a large chunk of patients who've been diagnosed with IBS, that their ranges vary, but a very good chunk of people who have IBS have SIBO as the reason for their symptoms. And so if there's just a ton of people running around with diagnoses of IBS, that if you simply just work on the SIBO, they feel so much better. So,
Got to call it like it is, right?
exactly.
So what is your approach to, so do you use breath tests to identify SIBO?
I've been doing this for about a decade. And when I first started, I did a lot of breath tests. These days, I feel confident enough in my clinical judgment that I just kind of skip to the treatment
Yeah.
and save them a couple $100 for a breath test. Breath tests are wonderful. They're great. They're validated. But oftentimes, it's sometimes hard for me to immediately discern, does this patient have maybe a low-grade candida, some SIBO, or what I call a dysbiosis, which is simply an imbalance in the microbiome, right? They may not have huge numbers of bacteria in the small intestine, but instead they're just imbalanced. You don't have enough goodies and too many baddies. And the truth is that where I work at the Ruscio Institute, we're really trying to simplify functional medicine. We find that treatment programs have gotten just out of control, crazy, way too much is spent on testing. And we have kind of a general treatment plan that is tailored to everybody, but that really does help clear up a lot of SIBO. So happy to talk more about breath tests at any level of detail that you like.
Well, maybe we're just talking about like some diet considerations, maybe some supplemental, some ways to kind of start tweaking if we identify, okay, I have alternating diarrhea, constipation, some severe painful bloating after meals. So maybe if somebody listening, somebody viewing this suspects that they might be fitting into the SIBO picture, what are some things that we can start to do?
Absolutely. So the way I think about this is it depends on where a patient is starting from a diet, right? I'd be willing to bet that if you're a patient listening to this show that have spent time on your Friday staring at me, that you're probably eating a healthier diet than the vast majority of people out there. Okay. So if you're starting from the standard American diet, you have to move to a whole food, plant-based diet primarily. That's kind of number one, right? Get rid of the processed foods, get rid of the sugars, the processed carbs. Probably most of your listeners are already there. So if you're still having symptoms at that point, the next stage typically is to, in my practice, is to go towards a paleo type approach where you eliminate gluten and dairy, the processed carbs, sugars, some grains, not all. And if you've already done that, then the next step would be.
I think you're hitting on our listeners right now because we're definitely kind of a paleo bunch.
Oh yes, okay, my people. Hello.
You're in the right space.
And if you're already doing the kind of paleo first and you're still having troubles, that's a lot of the people that come in and I see a FODMAP diet is the next step. There are other things after that, but just the FODMAP diet is a special place in my heart because it just fixes so many people, and so many people have done it incorrectly at first. But when you spend just a little time kind of helping make it simple and practical, people get better. So
good. Good. So, and it really kind of, there's lists and lists that go on online. So it's kind of just finding that and tailoring it to you and seeing what helps.
Yeah. And it's important for people to realize if you Google some of these things, if you Google if you want to make yourself nuts, right? Google a candida diet and then pull up 4 different spreadsheets and be like, or
these are all on the no list.
But this doctor said this one and this one doctor said this.
Yeah. Yeah. It's really hard because there's so many conflicting viewpoints out there.
What we're looking for are moving the big rocks first, right? The big problems, right? And then you worry about the little details later. Right. So that's kind of general diet advice across the board.
Good. Yeah. Good. And so then I also kind of wanted to tie in. So, working with internal medicine, I feel like in any aspect of medicine anymore, thyroid health comes up. So how is it that you in practice tie gut health to thyroid function, and maybe kind of how negative diet, like poor diet, all of these things can negatively impact the thyroid?
Yeah, I think about when I'm thinking about a patient, I'm thinking of what what tools need to be brought to bear for this particular person to get them better. And
Mhm.
a lot of the patients in my internal medicine practice, they were eating crappy diets, right? So when I moved them to a paleo diet, gave them some general nutrients, some general supplementation, I would see improvements metabolically. I
Right.
would see improvements in their TSH. All of a sudden, they wouldn't need as much medication, right? And so, victory, right? And then
Yeah.
you get some success, and then you get more challenging patients. I think that's the way medicine goes, right? And so then all of a sudden, I started treating the patients who were already eating well, right?
Mhm.
They're already taking some supplementation. They're already exercising and sleeping. And so I'd say, oh, man,
Now
what
what?
do I need to do for these people? And and I remember training at the IFM and doing kind of the Institute of Functional Medicine. And I had one case in particular, Kathy. She just wasn't getting better, right? She had strict elimination diet. I was giving her
Mhm.
magnesium and CoQ10 and selenium, right? She
Mhm.
got a small dose of probiotics. I was giving her fish oil. I was having her meditate. I was having her remove all these anti-inflammatory foods, and her thyroid antibodies, right? The marker that we use to say someone has autoimmune thyroid problems, were
Mhm.
just still sky high. I'm like, oh my gosh, what do I do?
Yeah.
That's when I came across Dr. Michael Ruscio's work. And
Mhm.
this was early in my career. And he's preaching this: fix the gut and watch the thyroid get better. So I said, I don't know what else to do. And I started applying those principles, and all of a sudden watched the thyroid antibodies go blunk, 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 down,
Wow.
down, down, and seeing working with the gut in a direct way where other things didn't work, and watching those
Mhm.
antibodies down was kind of the index case for me. And
Yeah.
since that time, I've seen that happen dozens of times, right? So I'm totally and utterly convinced that the single best way to improve thyroid function is through the gut. It's
Yeah.
not through chasing hormone doses. It's not
Mhm.
through nutrients, right? Those things may be helpful or have a place, but not before getting the
Yeah.
gut better.
Yeah.
Did I go on too much of a tangent?
Absolutely. No, I think that that's great because if we're allowing things, out of the gut into the bloodstream, it's going to negatively affect, like I said, the brain, the thyroid, kind of everything downstream.
Mhm.
So we got to seal up the gut, make sure that it's kind of all, only getting what it needs to. And then if there's some level of malabsorption, then the thyroid's not getting what it needs because it's not being absorbed. Absolutely. And so with hypothyroidism being so omnipresent anymore, how is it that you see that this is being inappropriately diagnosed? And maybe how should we look at the thyroid antibodies?
This is another one of my favorite topics. So these days, I'm seeing patients that primarily have failed other approaches,
Mhm.
and there is a trend in integrative alternative medicine, functional medicine, that if you simply get the thyroid hormones in a perfect optimal balance, that everything will snap into place, the energy will improve, the hair will grow, the libido
Mhm.
will come back, the weight will come off. It's not true. It just, I just have not ever found that to be true. And worse, what I'm seeing is patients who have low grade brain fog or fatigue or difficulty with weight being just micromanaged on hormones, and saying, well, your TSH is 5, so therefore you have hypothyroidism and you need to be on hormones for the rest of your life. From my perspective, I think this is one of the few things that conventional medicine gets right, where they say you are low thyroid, you have a diagnosis of hypothyroidism,
Mhm.
right? When your TSH is above 10. And I think it's important, and just throw something at me if I'm babbling too much, but
No, I love it. Keep going.
I think it's important to that we be really precise with our language when diagnosing hypothyroidism.
Mhm.
And so what I mean by that is there may be a patient who benefits from low dose thyroid support from a small period of time. But
Mhm.
that is very, very different, in my opinion, than saying you have hypothyroidism and you need thyroid. What that does to a patient psychologically is very, very different. And the truth is that the vast, vast majority of patients who have a TSH that's slightly elevated, indicating maybe sluggish thyroid function,
Mhm.
will get better all by themselves, maybe a third.
Mhm.
So if we're putting medication, these patients on a huge medication for the rest of their
Yeah.
life, that's a burden. That's a problem.
Yeah.
Furthermore, this is kind of where the gut work comes in. If you can heal the gut and improve thyroid function, why would you not just put these patients through a very simple gut program first and
Yeah.
foremost? So The issues are practical, and I think that they're an area where people have gotten a little ahead of the body of medical evidence, where they're saying you have hypothyroidism when they had their blood measured at a single time when their thyroid might have been sluggish, where they had to check in a week or a month, or after they actually stopped eating the Twinkies or all the Doritos like I did last night. Then they probably would be in a different place. So there's a time and a place, but we see so many people coming in and saying, my thyroid is acting up. My fatigue is my thyroid. I'm being hurt by my thyroid. I'll always have a thyroid. And that's very destructive. It's very hard to have 100-year-old heart or brain if you are self-identifying it as a disease. And I think that we as a field need to do better on this particular field.
I agree with you. Because nobody likes to be told that no matter what it is, you need to be on a statin the rest of your life. You need to be on a blood pressure medication the rest of your life. You need to be on thyroid replacement the rest of your life. Mm-hmm. It's all kind of one and the same, but it's like, why is your thyroid getting to this point? Why is it being sluggish? What can we do to improve it at a baseline? So rather than just getting out the script pad for any old reason, we need to do better. Yeah. I completely agree with you. So if you're listening and you're somebody that's like, you know what, I don't want to take this medication every day, an hour away from other supplements and food, and because it's, kind of tedious taking thyroid and getting that schedule down and everything. So I would say, do better. Find a doctor. If you don't have one, find a doctor that will do the digging for you, will help support your thyroid and heal up your gut and kind of take all these steps to improve your baseline health as it is. Because we also have to have a 100-year thyroid. So it's all connected.
Absolutely.
So a really big topic that I think maybe is a little bit under discussed is this communication in the body between thyroid and cholesterol. I think that our listeners can appreciate that, being really interested in cardiovascular function and cardiovascular health. So what can we say about thyroid and cholesterol?
It's pretty well known that alterations in thyroid will jack up the lipids. Mm-hmm. So as one of the first level solutions here, if you're seeing a patient and they're coming in with high lipids and their TSH is above an appropriate level, talk with your doctor about what that might be, right? We're not saying it's 3 and it has to be 0.5, but when the TSH is elevated and you have true hypothyroidism, it's always fun to simply give them a small dose of Synthroid and then watch their lipids go, mm-hmm. right? And that's what we're looking for in functional medicine. Well, what is the treatment this patient needs to get the best effect, right? Mm-hmm. And so when there is hypothyroidism, you absolutely, I've seen alterations of 50, 75% elevation in lipids with true hypothyroidism that just goes away with a week of medication, be it Synthroid, be it Armour Thyroid. Mm-hmm. I think that's pretty well known.
Yeah.
So that's kind of the first thing. So if you have a patient and they're saying, I'm worried about my cardiovascular health, and I have high lipids, a good clinician, I think, is looking at thyroid as one of the things first.
Yeah. I think so. I agree.
Lauren?
I do. But I also see, patients that come in and maybe they've only had their TSH tested once and it was, pretty normal. Maybe they have some subclinical hypothyroidism, and whatever doctor they saw wasn't really doing enough digging and doing enough proper testing. And so then they get thrown on a statin and then they come in and they're like, you know what? I felt like garbage when I was on a statin. So what else can we say? And then it's like, look, we just had to look a little bit deeper at the thyroid function.
And this is not hard. This is one of the things that I so wish that the conventional medicine would just kind of open their eyes a little bit. It's not hard to get a TSH, right, the major control hormone, and then a free T3 and a free T4. These are not expensive. They're not complicated. And these are the actual hormones that are doing the work. And so a lot of times what I would observe, particularly in my internal medicine practice, was that a patient would come in and their thyroid would be a little wonky, but their free T4 would be fine. You just take a look at the free T3. It was in the tank really, really low. And you give them a baby dose, tiny, tiny dose of free T3, maybe only for a few months, and they skyrocket up. And I think this is one of the things where conventional endocrinologists are just stubborn.
Oh yeah, absolutely. I mean, I worked with an internist for many years, all through medical school, and even thereafter. And he's brilliant. But I'm like, why do you not just add free T3 and free T4 to this panel that you run on everyone? He's like, well, why would I? Why would you're not testing thyroid hormone? You're testing what's going brain to the thyroid. Why not test what the thyroid's doing?
You have an FDA approved Armour thyroid medication that's been used for 50 years that works. Why would you not, doc?
Yeah. So I kind of can't understand that. But then, okay, so maybe furthering the discussion about cholesterol and lipids, what can we say about, so a patient's like, you know what, my thyroid is tip-top condition. I've never been medicated for thyroid. My levels are perfectly normal, but I still got high cholesterol. What are some additional considerations that we can think about for
I'm so happy we get to talk about lipids because in these talks, as the medical director of a clinic where we primarily do gut, chronic disease, chronic fatigue, autoimmune, mold, thyroid, it's really fun to be able to talk about lipids.
Yeah.
Where would you like to start? Lifestyle, diet, supplementation?
Let's start with the foundational lifestyle, diet and lifestyle.
So I'm a stickler for sleep. Because I find that this is often missed.
Yeah.
And particularly in people who are already kind of more advanced from a knowledge standpoint, everybody kind of knows they should be eating well and kind of knows they should be exercising. So that's not really that much news. So if you don't know that, I'm Dr. Joe Mather, and I'm telling you, you should be eating healthy and you should be exercising.
Right.
But all your listeners are doing that or know that already. So sleep is the next one I usually focus on. Because if we're not sleeping properly, we are increasing the amount of sympathetic nervous system activity. So our blood pressure will go up, our blood sugar will go up, right? The stress hormone response will go up. We'll start releasing more glycogen from the liver. All of the hormonal and biochemical responses as related to high stress get jacked up. And guess what that does? It takes your 100-year heart to like a 50-year heart, right? So sleeping well lowers the amount of sympathetic nervous activity. And one of the things that I don't think people realize is that males make the vast majority of their testosterone at night. So if you want to have healthy testosterone, you have to sleep.
Gotta sleep.
Females are regulating all of their orchestra of complicated hormones at night. If you don't sleep, that doesn't happen. And
Are you calling us complicated, Joe?
I almost used a different adjective, but then I figured my wife would get me. Yes, you're very maybe it's fair to say that you guys are normal, but we are just simplistically because it's like insulin and testosterone, and you idiots just fix those two things and you go away. So I guess you can look at it both ways. Sleep is very critical for any sort of longevity and health.
Yeah. Again, so incredibly foundational. We gotta shut down, shut off, kind of reset.
We're finding a lot of low-grade sleep apneas or upper airway resistance syndromes are contributing to chronic fatigue in our patients. They may not be patients who are, they may be a small body weight person who have smaller airways and they're not oxygenating well at night, right? And then that's causing this oxidative stress and sympathetic cascade that causes the fatigue. We're finding that in a fair number of patients as kind of, I think, an unrecognized cardiovascular risk factor.
Oh, yeah. Yeah, absolutely. I mean, because if you think about it, your body's recognizing we're not getting enough oxygen. So it's like kicking you awake. And, patients will often say, oh, yeah, I wake up kind of gasping for air. Maybe they think it's like a dream or something else that's kind of triggering. That's like, no, you're not breathing. Your sympathetic cascade is just surging out these hormones. So your body thinks you're being chased by a bear.
Yeah.
But in all realness, we're just trying to get some sleep at night.
I told the same thing. I say, like, pretend, we're sitting across from each other, we're having a conversation. Let's pretend that I just take my hands and I just squeeze around your neck, like just 20% of your airway. Like, you think your blood pressure might go up and your stress hormone might get a little anxious. Like, that's what's happening.
Yeah.
It's not good for you.
That's a good analogy. I'll have to start using that.
Besides, I get to kind of like, let's see, where's the camera? I get to kind of like.
There you go. Okay, so sleep. So what might be some, so we kind of talked about obviously getting, some processed foods out of the diet, getting movement. Is there any sort of movement that, I know that I've got my feelings on this, and maybe we probably are in alignment, but is there any type of movement that's best or more beneficial than, anything's better than just sitting down all day, but is there anything that really we should strive for?
Maybe I'm too simplistic on this. I would love to hear your thought. I ask many of my patients who are not sleeping to start lifting weights. I think that
Hmm.
there's something about the neurologic process that someone has to do when they're coordinating weightlifting, particularly if
Yeah,
they're full body exercises, that fatigues them, makes
right.
them uniquely tired more than just the muscle soreness.
Hmm.
I haven't thought about it much more than that. I try to get my patients to walk for 45 minutes and then on top of that, lift weights, meet
Yeah.
them where they are. But do you have different thoughts? Do you find that
No, I think that's kind of
around?
one and the same. Yeah, pick up heavy things. And if you're going to go for a walk, I try to suggest so increasing muscular demand, right?
Yeah,
So rather than just walking flat pavement, maybe if you're on a treadmill, put up the incline. If you're walking outside, find something with some hills. Um, yeah, but I mean, really picking up heavy things and obviously starting where you're at. If you're like, you know what, I don't want to go to a gym every day, grab a stack of books and just lift them over your head or anything, just carrying, lifting weights.
kettlebells are pretty awesome. I mean,
They
they're
are.
like $1 per pound, so you get the $25 kettlebell, and that's really
Yeah.
easy. Kettlebell
Yeah.
swings are great.
And
Yeah,
there's so much that can be done like at home anymore. I think that gyms having access to all of these different sets of equipment and everything is so wonderful. But I think we learned through the last couple years that we can do anything from home if we really set our mind to it. So,
yeah,
if it's like some heavy soup cans or whatever it might be at your house. But yeah, like you said, some, considering balance with the movement, but all of that increasing the HDL, bringing down the triglycerides and everything, increasing your insulin response, all of this downstream benefit that comes from lifting weights. So start
all
lifting weights.
right. We're going to be friends, Dr. Lauren.
I love it. Anything else you'd like to elaborate on that note?
Um, no, I think usually I tend to have a different opinion on statins than most of the people in integrative and alternative medicine. So I'd be happy to talk about
Let's
that
hear it.
later. Maybe we would probably, if we don't talk about fish oil and red yeast rice, then I think that we would be doing people a disservice
All
because
right,
those are
let's
the
let's do
primary
it.
tools I see for. Okay, well, let me back up a sec. So when we're talking about cardiovascular disease, right, in there are lots of risk factors. One of the risk factors are lipids,
Mhm.
right, and by that we mean the carrier molecules oh, you see my hand, that hold cholesterol and
Mhm.
triglycerides in them, right? So the cholesterol is actually inside the carrier. The carrier is the LDL. The problem is when that carrier bonks into the artery, the vessel wall, it can then go through the vessel wall and deposit the cholesterol and the triglycerides. That causes the process by which we start building plaque.
Mhm.
And this is a process that happens to everybody, no matter how well you exercise or sleep or how well you eat. If you live long enough, because you have these carriers and you need them to stay alive, if you have these carriers, you have collisions. So the aim of the game, in my perspective, is to reduce the number of collisions over time so that you can die of something else.
Right.
You don't die of a heart disease, a stroke, right? Diabetes, renal disease. Those are the primary reasons. Dementia, vascular dementia. You don't die of those things that can be prevented if you simply had less of those carrier molecules. So you're always going to have them bonking around in the
Mhm.
vessels, but if you can reduce the collisions by a half
Right.
or 80% or whatever,
Mhm.
you're going to live longer. It's just the way it is. And this process starts early in life, right? We've done autopsies of soldiers. I think it was World War II, could be World War One, but
Mhm.
either way, they cut open healthy, otherwise healthy 20-year-olds, and they had the first signs of plaque buildup in their
Mhm.
arteries, right? So certainly by the time you get 50, those of us who make it to 50 have plaque, and then if you have 60, you have more, and 70 and 80. So you want to do everything you can to keep your lipids low. Some people with mild hyperlipidemia do fantastic. And probably the vast majority of the population simply needs a healthy diet, exercise, maybe some gentle support.
Mm-hmm.
The things that I use the most for that gentle support, are the things that has the most scientific evidence, right? So fish oil, we know particularly high dose lowers lipids.
Mm-hmm.
Flax, I love flax. Flax
Mm-hmm.
fiber is one of my favorites. We know
Yeah,
CoQ10, right? There's a compound called red rice yeast that actually works in the exact same way as a statin.
it is a natural statin.
It's
Yeah.
a natural statin, works in the same biochemical step, same thing. And my favorite, probiotics. So we have multiple studies showing that probiotics just by themselves lower lipids. So not only do we have a couple studies, we have actually a grouping of studies. So one study will be one clinical trial.
Right.
And then if you group, say, 18 studies together, you have what's called a meta-analysis.
Mm-hmm.
And the cool thing is that just giving probiotics, working on the gut health, or reduce cholesterol. But not only that, we have another grouping of meta-analyses that show decreased waist circumference, decreased
Mm-hmm.
blood pressure, right?
All other independent risk factors.
Body fat, right. So probiotics are somehow working on the whole system to reduce cardiovascular disease. So if you're not taking probiotics and you're worried about your heart, it reduces your blood sugar independently.
Are
Probiotics.
there particular strains that were studied, amounts? Maybe we need to look over like 25 billion, maybe higher, lower, anything particulars?
The way the more I delved into this question, the less I got an answer. That there most of the studies study very small doses of one strain because conventional medicine wants to isolate one variable and study that. What I see clinically is that the more the better, and the
Mhm.
bigger diversity the better. So
Right.
when I think of probiotics, I'm thinking of three classes: the lactobacillus, right? Um, the soil-based organisms, and then a
Mhm.
yeast called Saccharomyces. So
Yeah.
in my clinic, in my world, people get all three, and they
Okay.
get them in a combination.
Awesome.
Because I don't think we're smart enough to be able to say, you need Lactobacillus rhamnosus, and you need Streptococcus, and you need Saccharomyces. I don't think it's that simple.
Yeah.
And so, given that we don't know that much, I give them all.
Yeah. Diversity is good. Yeah. And, and that's what I suggest also is like mix it up, get a little bit of everything, do your fermented foods, because that's a great way to kind of inoculate with multiple kinds of probiotic strains.
Yeah.
So yeah, I think that that's all very interesting and maybe kind of under prescribed, if you will, because we think definitely the fish oil, the movement, so some supplements that are really honing in on the gut health, affecting cholesterol. I think it's absolutely critical and a great way to kind of elaborate on that.
Yeah.
Well, cool. Well, I think that we should maybe put a stopping point to here and now so that patients and listeners and everybody can go on with their Friday. But we will be speaking again. I think that this has been a very beneficial conversation. And if you would, Joe, tell all of our listeners where they can find more about you and your work and your practice and learn a little bit more about you.
Yeah. I'm the medical director of the Ruscio Institute for Functional Medicine. So it's just RUSCIO Institute.com. I see patients there. We've got a growing number of clinicians that are our mission is to simplify functional medicine,
Mm-hmm.
make it cost affordable. We primarily see patients who've failed other approaches,
Mm-hmm.
failed other integrative or conventional medicine approaches, but we see a lot of patients with gut problems, irritable bowel, a lot of irritable bowel,
Yeah.
inflammatory bowel disease, SIBO, thyroid,
Yeah.
and I like cardiovascular health. So if you have questions about lipids, I'm happy to torture you with all my
Awesome.
opinions.
I love it. Again, we could probably do a whole conversation just about lipids alone.
I
So
know.
I
We
know.
didn't
So
even get to argue about statins.
I'm happy to argue you about statins and even red yeast rice, actually. So I think that that's awesome. And we will definitely be talking again. This has been so great. And it's really been a pleasure speaking with you and a pleasure meeting you. And so let's do this again. So everybody, thank you for listening. Thank you for joining. Please share. This is going to be available on our YouTube and on our Facebook platform as well. So share with your loved ones, share with your friends, and so we can learn more about healing in the gut, how it really all does start in the gut. We knew this 2,500 years ago. Hippocrates knew it. So we just kind of
You nailed
got to
it.
follow suit
You nailed
and
it.
get back to the basics. So thank you again for listening to the special live edition of the Healthy Heart Show. Hope you all have a wonderful weekend and a great day. Thank you.